casino, and I've been placing implants for over 20 years, and I often get the same question about implants. People who have to lose a single tooth ask me what's the process in getting an implant placed, and why does it take so long? Certainly we all see ads on TV about teeth in a day, and those are generally not for single teeth. Those are often for people who need all their teeth taken out, and they're going to put in a screwed into the implant set of teeth. So it's a little bit different when they do talk about the teeth in a day versus when somebody has to lose one tooth. And all in all, you want the implant placed properly with good bone support. If the implant is done properly, then it should be stable and healthy and look good cosmetically for many years. And so it's important to do it correctly. So first and foremost, sometimes when a tooth needs to be removed, sometimes you can't put the implant in right away. The difference is, though, that an implant has a different shape to it than a tooth. An implant is like a little screw, and a tooth has roots to it. So ultimately, when the implant goes in, it needs to be stable in the bone. So sometimes we use 3D imaging to see if we feel that you could be an option to place an implant right away. Certainly in big molar areas, it's more challenging than in front teeth. And certainly in front teeth, it's nice if you can put the implant in immediately. It does shorten the time. So often in front teeth, we try to, if possible, if there's going to be good bone support, put the implant in right when the tooth comes out. So if you can place the implant when the tooth comes out, then it needs to heal 2 or 3 months, and then you can have your dentist make a tooth onto it. Sometimes a tooth can be attached at the time when the implant is placed, but that does add a little more risk of failure. So I generally recommend letting it heal, and then for 2 months, and then having a crown put on it. Do you go without a tooth? Certainly not. If it's in the cosmetic zone, you can wear kind of a flipper, which looks like a retainer with a tooth attached to it. I've had some dentists who bond teeth to the teeth on either side, so it's nice and stable. So you'll never be without a tooth. So it does speed up the process, certainly, if you can put the implant in at the time of the tooth removal. But sometimes we just can't do that because there's been bone loss, or the bone or the tooth is too big that we're taking out, and we can't get good stability for the implant. So what do we do then? So then the tooth comes out, and generally we put bone in the socket. We put bone grafting in the socket. And what the bone grafting does is it holds the bone you have. It doesn't unfortunately grow extra bone, but it keeps the bone you have. When you take out a tooth, there's a hole. And if you don't put anything in it, it's going to collapse somewhat. But if you put bone grafting particles in the socket, it helps hold the bone out and allows your bone to fill in. The bone particles do get resorbed with time. So usually we take the tooth out, put some bone particles in the socket, and then we let that heal, depending on the size of the tooth, generally 3 to 6 months, depending on if there's bone loss and how large of a tooth it is. Once that heals, then we do a 3D scan of your jaw. It's kind of a mini CAT scan that we do of the jaw, and we can 3-dimensionally look at the jawbone. Do we have enough height and width of bone to put an implant in? We look at vital structures. There's a nerve that goes through the jaw, or a sinus cavity in our upper jaw. So we want to make sure that that's not in the way of placing our implant. So then, after things have healed and we do the CT scan, if everything looks good and we can place the implant, then the implant goes in. Then the implant needs to heal too. We need the bone to heal to the implant. If we attach the tooth to it immediately, the tooth can bump the implant around and not allow the bone to heal. After the implant goes in, it's generally allowed to heal 2, 3, 4 months, depending on the bone quality. And we do need to be careful with it, not to bang the implant around, and we want to let the bone heal to the implant. Then, after the bone is healed to the implant, after that 2 to 4 month period, then you can see your dentist and have impressions and have a tooth made. You do want an implant placed properly, and sometimes doing things a little slower can in the long run be worth it, because it'll give you a successful, healthy implant that looks cosmetically good.
Please visit our website at napervilleperio.com to learn more about dental implants.